So Wilco came back from his last trip to the States and he texted me that he saw some incredible stuff and that I should definitely go and talk to you. And he even talked to my wife, and she's always a bit less improved fast, quickly, but she was also very hyped. John, what did Wilco witness over there? What did you do?
Well, one of the things we did is we produced a class that was ready for him. So we didn't wait to have this class done to us. We like prepared for him. So we put, I don't know, maybe we had 16 chosen people in a group that had really done their own work and that were prepared to take that class and go as deep as they possibly could. And then I happen to have a client here dealing with birthing trauma, and we invited Wilco in to sit in. And it's probably some of our most advanced work that we do here, which
Hmm.
involves helping a mother complete her birth, uh, and and then bringing the baby that was in the room into the treatment model, and we actually rebirth the baby.
All
And
right.
so that's a practice that's developed over the years. Um, it's developed from practicing hundreds of hours and seeing patterns. And what we realized we could do is that we could put a baby back into in utero positions safely and softly as we can, and that they would start pushing for a birth again. And then we would provide constraints for them to work through.
All right.
That
Before you go any further, maybe we
Mhm.
should first know who you are, who we is, and what do you do?
Okay. Um, Well, let's see. So I started practicing in 1992.
Practicing
I
what?
practiced 6 years in sports rehab. Um, After 6 years in sports rehab, I left that practice. By the way, in that practice, 18 patients a day was the norm.
Wow.
Multiple times I saw 28 patients in a day. That sounds unbelievable, but I would see 25 minutes, 5 minute turnaround, and there was a couple of times I worked 14 hours.
All right.
And I don't advise that to anyone. But for me, if I was studying, which I was studying extensively at night and weekends, and I had a couple of mentors that I would study and then would go practice the next day and I would see 18 patients. And I was able to, I was able to accelerate through uh, different practices and became really good at different practices very quickly.
Hey, and are
Um,
we talking about massage therapy or therapy?
yes, yes,
Okay.
I am a massage therapist and body worker, I would say.
Body work.
So I spent 6 years in sports rehab, and in that practice, had a chance to do all sorts of things. There were chronic pain issues that came there, sports, a variety of different things. I left that and went into a private practice where I began to also learn the business side of this work. I in the state of Texas, a you don't have to be a chiropractor to own a chiropractic clinic. And so I opened a chiropractic clinic called New Health Integration. And after a period of time, sold that and then went into about a year and a half of just kind of recovery.
Hmm.
Um, and then after that, we had noticed this pattern of women who had had C sections having problems with TMJ jaw dysfunction and plantar fasciitis.
Wait,
And
wait, wait, wait. Okay. So women who had a cesarean
yes,
had problems with their
TMJ.
and
We
that.
noticed this pattern that if you had that women who had had a surgical birth, let's put it that way, were more likely. This is what we found out eventually is that they're more likely to have dysfunction in other key areas.
Yeah, and
And
TMJ stands for it's your jaw,
the jaw
right?
joint, yes,
And your
yeah,
plantar fascia is in your foot,
in the
right?
foot,
Oh
yes.
wow. All right,
And
continue,
so,
continue.
and it was so obvious that it wasn't like something. It wasn't like a fluke. It was definitely something going on there. So we began to explore that. And in doing so, we ended up opening a clinic called the C Section Recovery Center. And we started working specifically with hundreds of women who had birthed surgically. We were still seeing women who had both birthed normally. Um, And what happened in that is we started seeing another phenomena, and which was that a surgical birth is not a complete biological process.
Oh wow.
And that seems kind of obvious that it's a surgical birth, that it might be incomplete biologically. But what we began to explore was a question, and the question was, what would it take for us to produce the experience of completion? And so we're working with, I'll back up a little bit. I got ahead of myself, but we'll back up and say that this TMJ dysfunction, and so this dysfunction developing in the jawline post after C-section, and the tendency for other areas like the feet and things to have problems, we went about correcting those not from those areas. So we were working with respiratory diaphragm, pelvic floor, autonomic nervous system, all of those areas. When we began to restore function in those areas, energetically, lymphatically, myofascially, visceral, all of those, what we noticed is those problems began to either go away or they became very treatable.
Wow.
And so along with that, we started this process of exploring what would it take for us to help the mother to experience a completion. And so we started using different breathing techniques and diaphragmatic movements. And I sat in on a bunch of births, and we began to figure out what would it look like to replicate a vaginal delivery physiologically in our practice, using things that the patient could do, but also using hands-on techniques
Mm-hmm.
and just
Mm-hmm.
a whole lot of different techniques. And so we found, actually oddly fast, that we could replicate that experience.
Okay.
And it was, sometimes we would have a mom there that was seeking a vaginal delivery again. And so the best thing we could do is to help them to be successful there, because the greatest way to complete a surgical birth would be to birth again vaginally.
Mm.
But if that wasn't going to happen, then we really leaned in heavy on how, asking the question, how do we help her experience completion? And we've been very successful there. And at some point, we realized that, well, what about the baby? If she's incomplete, then the baby's incomplete. And so we started exploring that. And we were also very successful there. And in doing so, we began looking at, what are we going to do with the C-section recovery center? This place is doing really well. We need more centers. There's a lot of people that need help. They're doing thousands of C-sections a day,
Yeah.
you know. And then we realized there was another problem, and that was that there wasn't enough qualified help. That it was very hard for us to come by that training. It was very hard to replicate that training, and so we realized that going, let's say, nationwide in the United States with C-section recovery clinics probably wasn't going to work. And so we had this idea of buying a local school. It's a school in my mind that I always felt like I wanted to own, kind of, or I wanted to be the steward. I wanted to work there, I wanted to be involved.
Mm-hmm.
I had hired a lot of therapists from this place. And so I contacted the owners, and after about a year and a half of negotiations and all the businessy things, we acquired where we are now, which is the Kikino Institute of Healing. It is a school that's been open 20 years now. I've owned it for 6 years. Um, we have over tripled in productivity here. We train 60 students a year here and see about 800 patients a month. And we have
Wow.
three different clinics here. We have a corrective clinic. We have the family clinic that houses the C-section recovery center. And we have another project we've been working on for a few years called Finding Zero, which is just another thing that, I'll use the word birthed. Out of all the work we've done, it kind of birthed out of that, was that there's this work we could do to help patients have accelerated access to a zero state, like zero, like the most relaxed and calm you've ever known to be, I guess. And
Wow.
so we started working on that process, which is specifically pointed at the autonomic nervous system, trauma. We do a lot of trauma work here, and a variety of other things. And that's where I am now.
Wow.
Um, I don't know that this project has been profoundly difficult, in that I got into it. I was very inspired to be here, and I realized I was not qualified from a business standpoint. So I've been I've been playing catch up. And something else that's kind of been a theme throughout this process is most of the time I haven't been deficient in training. I've been deficient in doing my own work.
Hmm. Hmm.
Um, it's just something that has become a fundamental theme or thread throughout our work now is the therapist has to do their own work. They have to do their own work. They cannot take their patient any further than they have gone. And they might could
What do
grow
you mean
together
with their own
sometimes.
work?
Pardon me.
What do you mean with do their own work?
Uh, Personal work. Try. Let's say that the therapist is has suffered a lot of trauma and hasn't dealt with it. Let's say that they're less maybe narcissistic a bit, or maybe they've got some other sort of dysfunction going on that they'll need to deal with those things in order to really help somebody.
Yeah, yeah, yeah.
Yeah,
So,
and so that's kind
yeah,
of been it. That's kind of the what's happened.
ve- very cool. So you got a school now. Are you teaching people to help people with C-section
Well,
problems?
that's a more advanced training. The answer to that is yes, but our focus is on getting them the more basic training. It is a school, so we are making sure that they complete here and can pass the test administered by the state. So we're very focused on that. We start the process of requiring our students to do their own work immediately in this training. It's immediately built into our first coursework here. And honestly, it looks a whole lot like what Wilco does in a way. So it's got a lot of overlap,
Oh,
which was
cool.
really nice. And then as they go through our school, they have multiple opportunities to step into our more advanced work. Uh, some of them are not a good fit, but most of them are.
Mm-hmm.
And the ones that are a good fit, we begin to channel them in different directions that they've been called to, because somebody may be called to the corrective clinic. But we have a group here called the Young Stars, and that's up to a year long program of advanced training that happens here in the facility. And so we usually have 4 to 8 therapists that are in that program, and that's a weekly training, and that is pointed at doing your own personal work and learning technique
Hmm.
and all of the philosophies behind that. So I guess the
Fascinating.
answer is yes. Yeah.
Hey, and back to the C-section. He's saying like, or my interpretation is like, okay, so a C-section, the body, the baby has left the building, the body, but the body doesn't realize it, or it's not
That's
full
probably a pretty good
circle.
way to put it, actually.
Yeah.
Um, Dr. John Upledger wrote in his book, some I think page 53 in some auto emotional release book. So, I'm somewhere around there. He has a chapter called "Incomplete." Let me see if I can get this right. Incomplete biological process, birth, death, and other transitions.
Hmm.
So the way we look at that is that there's three potential places where incompletion will happen. One is when you're born, one is when you're dying, and then significant transitions in between those things.
Yeah.
It could be stressful things like losing a loved one or divorce or all sorts of things.
Yeah.
Um, what he says that if you were to leave those things incomplete, what is left behind for the patient is what he calls retained biological frustration. And when we first read that, we had already been doing the work, so it was really nice to find that he had already been there because we thought we were kind of losing our minds. But that really, those 3 words, it really meant a lot to us: retained biological frustration. And the way we interpret that is frustration is the inability to metabolize something.
Hmm.
And so the work at the C-section recovery center and here is to help somebody metabolize something. You
Hmm.
could say an incomplete birth is a birth that hasn't been metabolized. It has not been completed. Or you could say that some sort of trauma that a person has experienced and they're struggling with it. You could say they've also not metabolized that trauma.
Yeah.
And
Okay.
so that's where the work stands. And
Okay.
then that work physiologically, it's this all sounds very complicated, but the frequently the work is not that complicated. Diaphragmatic restrictions, and let's say the vagus nerve innervations are stuck, and think in a really good, high quality, effective vaginal birth, a lot leaves the body at that last push, a
Mm.
lot. And in a surgical birth, none of that leaves the body, none of it.
All right.
And so we're going about helping that energy and that autonomic response that would have happened had they pushed a baby out vaginally.
Wow, I never thought about that. I
It's
re
kind of cool, right?
Yeah, it is kind of cool. I mean, I read that nowadays they when they have a C-section, they put vaginal bacteria on the baby because
Right.
they also need that. But I never thought about the completing the process and that it might be, yeah, have effect on the body of the woman of the mother, but and of the baby. You said.
Right. Well, and we kind of ran into another thing. I actually don't think any of the births are complete.
Oh.
In this practice, what's so beautiful about body work and massage as a practice and using touch is that we're always learning things new from working. Sure, we learn things new from studying, but really, the work is where we learn. And in that, I realized that none of the births are complete, and the only reason we think they are is because we institutionalized birthing. We took birthing from its natural setting, where I mean, there's many. If you look at South American cultures that still honor traditional birthing practices, they after a birth, there's all sorts of things being done over the next 40 days to help that mother complete. That's a vaginal birth. And what we're realizing and the way we practice now is we help all the women complete their birth. It takes about 40 days. And so the same practices that are needed in a more exaggerated sense with a C-section is the exact same practices needed with a mother that birthed vaginally. We recently had someone here that had twins 10 years ago. After her session here, she contacted us by text to let us know that she had just passed a plate size um, blood clot or like some tissue. She'd been sick for years. She was carrying that in her body. Like that's amazing to me that somehow her body had managed to hang on to that. It had walled it off and kept it, and we got pictures and all the things. So it's really amazing, and that's a good example of somebody that was she was incomplete.
But
She
what?
feels a lot better now, by the way.
Yeah, no, I can imagine. But what do you mean with not completed? Like because it's not more it's not a natural birth anymore. Like you don't you get sedated maybe and you're in a hospital, stuff like that.
No, I think wherever a mother births, she deserves the honor of a reasonable recovery period. And I think she deserves that, like from the environment and for the from the. I think she deserves that because of who she is.
Hmm.
I also think biologically that's reasonable.
Hmm.
I think birthing is beautiful. I also think it's like an injury in some ways. You think of like sometimes somebody gets injured and they don't close it up because they need to leave it open, let it heal from the inside out.
Hmm.
That doesn't happen in 12 hours. And yet we close up the mom in so many ways and we send her on her way to enter into some of the most stressful times she'll ever have. She'll get less sleep than she ever has. And she's supposed to be okay. And it really doesn't even make sense that and I think what the reality of it is that it takes time to heal and she deserves to heal from the inside out. And so that I don't know how much times that takes because it takes a different amount of time for everyone.
Mm.
But I think 30 to 40 days is actually I think that's pretty nice. And
Wow.
you look in some cultures, there's actually a book called 40 Days, and it's about the culture in India, um, in some of their traditional birthing practices and the things they allow. There's a lot of stuff in there that has nothing to do with her physical body. It has more to do with like temperatures of waters she's drinking and things like that. But regardless,
Mm.
um, this is not new. This was something that was known and has been forgotten.
Mm.
And I think the value of touch in general is a lot like that.
Yeah.
As much as it feels new, like we're having this realization of how valuable it is. I think that this was known at one time, and we forgot it, and now we're bringing it back.
Yeah, true.
Hopefully,
There was just in this paper this morning in Holland that for a baby, an hour a day on the naked body of the mother is very healing, very good also for the biodome.
yes.
So that's
So it's healing. You could also say that it's completing.
nice word.
That you just touched on the very thing we're talking about is that if I cannot complete and produce the experience of completion without contact. And I agree with you. And I think one of the things that's worth saying here is if you were in South America and you had a successful vaginal delivery, it's probably a really beautiful place to birth. But if you needed a C-section there because you had a real emergency,
Hmm.
you do not want to be in South America. And so one of the things we recognize being in the States is that if there's an actual emergency, this is a really good place to be. And so our crusade here is to add in the practices of as much natural birthing as possible and letting women heal like they should, to add into still having that emergency access here. And
Yeah,
then this would be the best place to birth.
yeah. And I think there's a trend that C-sections are more and more normal way of delivery,
Yes.
and more in hospital babies are born.
Well, as long as we allow a person to choose to birth surgically, and I'm not saying we shouldn't. I don't like to take a choice away from someone. I don't think that's ideal. But as long as that's a part of this, or we allow a doctor to recommend it, um, or we allow doctors to continue to to um, try to get moms to birth too early. I mean, the statistics around doing inductions at 38 and 39 weeks, most of those babies will be born by C-section, and it's a very predictable. They do a chemical induction. They they have this failure to progress diagnosis that happens at some point. The baby's not doing good is now the next language, and we need to do a C-section, and everybody's in a trap. In the breakdown is about if the mother goes to 41 weeks and does an induction, most of those are successful. And the
Uh,
difference is 2 weeks. It's 14 freaking days. That's unbelievable. So those kinds of practices have to change. I think here in the States, and I know nothing about what's going on over in your neck of the woods, but here midwifery is becoming very established here. We have a lot of midwives here. Um, so midwifery is really helpful. It's really
okay.
helpful.
Yeah.
And we also have some really amazing doctors that are not afraid to birth babies. And I think we also see something in medicine is that we have a lot of doctors that have never done a complex birth.
Hmm.
They've birthed a lot of babies, but if it let's say it was a breech baby, they've never birthed a breech baby.
What is
And
a
so they
breech
start
baby?
to, and so the hospital declines them to birth a breech.
What is
So
a breech baby?
a baby that is head up instead of head down.
Oh, yeah. Oh wow,
So
breech baby. Never heard of that. Hey, and
yeah,
mm, so not completed leaves uh, or could lead to problems in everywhere in the body, and you found a way to help women complete it.
yes.
Can you tell me about how that looks? The completion?
A mother comes in. We we don't focus on the baby at all. We really don't interact with the baby. We have someone in the room to take care of the baby.
Hmm.
We get the mother on the table and we start working with her through her abdominal area. We start evaluating specific areas of tension, um, and we begin using a hybrid of techniques to begin to get that area to clear or release. It might be the spleen, the liver, the very frequently after a surgical birth, the stomach is sitting too high. As you can imagine, when you push a baby out, your stomach might go down,
Mm-hmm.
like it might reposition viscerally, and so we begin to address all of those things. Um, it, that appointment, mother usually has a massive breakthrough in how she feels, and I would say usually like 90% of the time or something.
Mm.
Um, we follow that from her abdominal area to her head. Something else we recognized is that when a baby is pushed out vaginally, it also clears the head. They'll experience a mother that birth by C-section will feel locked up under her tongue
Uh,
and in her palate, and we begin clearing those areas as well. So we do a lot of work under the tongue, suprahyoids, lymphatic areas, all of that. And once I call it a cycle. Once we make it through a cycle, uh, we consider that complete for that appointment. And she gets up. We set up a table. I'm looking over here because I'm in that room. So we set up a chair on the other side of the massage table, and then I set up a chair on my side. And then we usually have a baby holder in the room. We also have another therapist in the room. Usually, we frequently have a midwife in the room, and mom holds the baby, and then the baby's passed to me or whoever the therapist is,
mm-hmm.
and we begin to evaluate the baby in a very similar manner. I have to think the baby's not been squished at all. There's been no therapeutic compression on this baby. And so, now that being said, some people are like you shouldn't compress the baby. We're not. We're using 3 grams of pressure, five
Mm-hmm.
grams of pressure.
Mm-hmm.
But some of the positions we put the baby in, the baby starts pushing, and at that point, it can get a little rigorous. A lot of times, the baby sounds like they're birthing and looks like they're birthing. Um, and so we have the mother set her hands up like this
Mm-hmm.
on the table, and we put the baby's head in her hands and the baby's head. And while the baby's pushing, and we're doing all sorts of work, at that point, we start working with the mother and the baby. A lot of times, mother at that point starts to disassociate a little bit, or she starts to check out as a
Mm-hmm.
stress response
Mm-hmm.
because she's going back to the birth,
Mm-hmm.
which most mothers find going back to the birth to be very stressful.
Yeah.
And so when it pops up, we get this new therapeutic opportunity. And so while that's going on with mom, we start treating mom and baby at the same time, and we allow for the baby to sit in these spaces of therapeutic opportunity, and we just wait and follow and wait and follow. And at some point, there's this kind of big physiological breakthrough that's exhibited. Pick the baby up, check them out, clear their mouth, and hand them back to mom. Mom does skin to skin and begins to breastfeed. And while the mom's breastfeeding, we start reevaluating the baby while in the breastfeeding position.
Yeah.
Does that help you?
Yeah. Amazing. And that's what Wilco witnessed.
That is what Wilco witnessed. Now, interestingly enough, I think there was a father in that session. Sometimes these days in particular, fathers have gotten a lot more involved, which we really, really like. Um, but sometimes we'll treat the father before we get to the baby.
Uh-huh.
Or in that instance, if I remember correctly, the father started having some emotions during the process. And when that happened, we don't just ignore that. Like we'll have someone in the room that begins to get their hands on him, and we begin to look at the family as a body rather than there being the mother body, the baby body, and the daddy body. We look at the entire thing, the three of them together, and for a moment, father a lot of times, or spouse, I should say, or will surface as the primary issue, and we'll have to divert our attention over there to make it work. And I believe I can't remember for sure, but I think that may have happened.
Okay.
Um, but yeah,
Hey, and I also realize, or a question is, I always thought of like giving birth is 100% job of the mother, but is there also activity in the baby when he gets when he gets born? Does he
ask me again the last part about the baby.
does the baby also engage into getting born? Is it an
Yes.
activity for him, or is he passive?
No, it's honestly it's probably I mean the part of our work that looks a lot like a birth, an actual birth, is actually the work we're doing with the baby. And yeah, does that answer your question?
Yeah, 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 yeah. Just realization I have. Always felt like babies are passive and they get pushed out, and but maybe they have some activities themselves too, right?
Right.
Yeah.
I'm so sorry. I'm having a little bit of a hard time hearing you. So
Do you want me to repeat? Do I
I'm
need
sure
do
that'd
I
be
need to
great.
do I need to speak louder?
That'd be great.
I'm sorry. I have a really small voice.
I'm a full disclosure here. Our people that take care of our yards just showed up, and they're never here on a Friday in the history of ever. They come every Tuesday, and I'm like, oh, they didn't show up Tuesday, but it was raining. So, anyways, I am so sorry.
No, that's
But
good. It's a good thing we don't hear it. Your sound is great. Your
okay,
sound is great.
okay, well, good. Hey, you're asking if babies are passive. If babies are not engaged with, they can become quite passive. Um, but we're taking them back. We're interacting with them in a way where they get a chance to show us what they didn't get. And so one of the ways for us to do that is to position them back to a in utero position. We have a pretty good idea that they were in a C shape of some sort. Um, and that we began to move them around until we find that place where like, oh wow, you've been here before. You can feel it. And when we get them in that place, we sit there with them, and what we find is that it begins to trigger, and they're like, "Oh yeah, I've been here. I've been here. I didn't like the way this went when I was here before." And so, in that moment, they're no longer passive. They're no longer passive. They become a very active participant in what's coming up.
Hmm.
Um, the other thing is that babies, for some people, might always seem passive, but it takes some training and some skills and some practice to be able to feel these things. It's not. I mean, occasionally we'll have a therapist that comes out of the school that's just built for this. It's like their whole life was set up for them to be just amazing at something like this. But it takes time.
Yeah, can
Yes,
imagine.
and this is not this is a portion of our practice here. We have a lot of other services here, but this is one of the services that we're pretty proud of it, and we would certainly love to begin to teach some other people how to handle that. The
Yeah.
Upledger Institute has a rebirthing component, and I know there's some rebirthing being done for adults in the Netherlands. Isn't that correct?
There's all kinds of rebirthing
Yeah,
with breath work, and
yeah,
we also have some rebirthing things. Um, it's a very important moment, of course, getting born, and I always I'm always amazed that we well I'm always, how do you say that, it's a very defining moment, of course. You were talking about getting born and dying. I guess these are the two most defining moments, but physiologically, we come out of a womb where we were living in water for 9 months, and all of a
right.
sudden we are getting pushed out, and then we have to breathe, stuff like that. It's enough to have issues with for the rest of your life, right?
Yeah. Well, I think for us that we think that there's this the way the birth went, and not. By the way, I want to make sure that a birth is really easy is not a better birth necessarily, but a birth that has some sort of therapeutic significance, that or an easy birth or a really hard birth or a surgical birth, when that when that child grows up, they're always kind of in reflection to the way that went. Like they're always reflecting on it in some way, and we might could build a case that everything that happens to them after that is in some sort of reflection to the way they were born, that it has some sort of influence on it. And so the value of rebirthing as a baby or any age, um, is that it's possibly like a way of paradigm shifting or rewriting those kind of patterns, so that let's say that now as a 57-year-old, I go back to reference my birth and I can't really get to the original birth because I had a new birth done.
Hmm.
So the original birth is no longer available to me. It lays on top of the old birth.
Yeah.
And so that's probably phenomenologically kind of what we're chasing here. And I think I don't know of other rebirthing clinics. I know that that's pretty popular where you are, and that I think that's what we're creating. I think some of the medicines being used in South America and things like that, I think create a rebirthing kind of experience, um,
Nice.
things
Nice.
like that. But
Good. Hey, and do you also have some time to tell us about your 0 point experience?
the, oh, finding zero. Um,
Finding Nemo, Finding Zero.
so here's how it happened. We started tracking average stress levels. We'd have people come in and we'd say, "What's your stress level average? What's your average stress level?" And they'd say 8, 7, occasionally a 4, but no, but everybody was 4 or higher. 9. Some people would make their own mark at the end on the right and put 13 or so. We started working on reducing average stress levels, and I one day had this realization is that a lot of that it's very difficult to change an average stress level. Um, and so I just kind of had this moment. What if we were to just create easier access to zero? And so I started asking questions. We started asking the same people. We didn't change anything. We started asking them the question: when's the last time you experienced zero? And 100% of them said, I don't know that I've ever experienced zero.
Hmm.
And so that was a kind of aha moment. And then I also noticed I had this other kind of group that was in that group that I noticed that they were very high performance kind of people, maybe in business. There's a particular person coming to mind, which I won't mention her name, but I thought, man, if she couldn't operate from a 10, she wouldn't even be able to make money anymore. She
Hmm.
literally gets hired because she's a 10, man. She's just very intense.
Yeah.
She gets things done. And I'm like, it's like a superpower for her. And I'm like, the real weakness for her is that she doesn't have access to the other side of that. We don't need to get her to be less like herself. We need to get her to have access to zero more frequently.
Yeah.
And so, a lot of body work we had already been doing was influencing that, and we leaned in a little heavier and did a little more research and training and stuff on how to work with the autonomic nervous system, without leaving our work around trauma and our work around the lymphatic system. We didn't leave one work and go to another and leave all that behind. We just melded it all together. And what we found is that we could get someone to zero in a single visit. And
Wow.
so I had this idea of this company called Finding Zero, um, which is accelerated access to zero through body work. And although that is a separate clinic here, uh, Finding Zero work is built into all of our work here. It's uh, it's like it's like a primary ingredient to the success of what we do, and that uh, I think there's a lot more. I think we'll be doing a lot more business wise with Finding Zero. I think that's a really good project.
Mm-hmm.
The training that our advanced training that we're doing here at Kikino is very much dialed into Finding Zero, teaching therapists how to clear the autonomic nervous system. We do a process here we call resuscitation, which is raising someone's vibration. And it's a fundamental part of what we do. And so those things are being taught at that level.
Wow.
But
Fascinating.
that's Finding Zero. Yeah.
Fascinating. Hey, John, you already answered some of it, but what makes a good therapist?
I well, the best therapist is one that has been called to this profession, in my opinion. Like they can't even explain why they're so interested. They just know they're just that to me is a very special therapist. Um, a second a second therapist that works for us really well is one that wasn't really called, but they can see how their past contributes to them being here. I have a I have, when I was 6 years old, my 9 year old sister had a brain tumor,
Hmm.
and I became a caregiver in so many ways. I like even though I was the middle child, I became the oldest child. Um, and in that, I can see how that began to shape me. And so, although I got called to this profession, I can also look back and see that that's kind of the bones of how I got into this situation.
Hmm. Yeah.
And I think those two things are really essential. And one, the third thing, a good therapist is a therapist that is looking into the mirror a lot. That every time a breakdown happens, they service that breakdown in a way that demonstrates that they understand that their practice is only as strong as they are. Their practice is only as good as the work they've done for themselves. So I think those are the basic things. And then a really healthy balance between study and work. A lot of therapists, we have therapists come here and ask us like, "What am I doing wrong? I've taken all these classes," and all of those therapists, we realize they don't practice enough.
Hmm. Yeah.
I'm like, "Have you seen 1,000 patients yet?" They're like, "1,000?" Like they're like, "I've seen 120." I'm like, "Yeah, find somewhere where you can see 1,000 patients as fast as possible."
Yeah.
And because they'll have like 100 hours of training past their normal education, and I'm like, it's too much. You need some work, like, and so I think a therapist that's understanding that makes a really good therapist. I think a therapist that has a mentor makes a really good therapist. I think,
Mentor, like
um,
as in a supervisor, or?
no, 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 like a guide. Well, Wilco's, I'm assuming, do you actually own the Esoterra School of Massage?
Yeah. Yeah.
Yeah, I'm sure you're a mentor all the time, like where you're like a guide for your students, like that.
Okay.
Wilco's a really great mentor. Like
Hmm.
he is, and when he left here, like a lot of people are still influenced by him and are still looking out to him for
Mm.
direction. And I have a lot of students that look to me for direction, and I like that because I I am able to help someone to navigate becoming a really great therapist without all the mistakes that I made. Now they get to learn their own mistakes, right? But at least they don't have to make mine,
Yeah. All
you
right.
know.
Yeah.
And so I think that becoming about as good a therapist as I am could take 10 or 15 years rather than 33 years.
Nice.
And I think that's a really important part. And I think those are the kind of the characteristics of a really good therapist.
Nicely put. Nicely put. Yeah. Well, it's not a job where you can be in a hurry to learn it. So you really have to get it into your system, right?
Yeah, you do. It's an incredible profession. Um, for me, I really thrive on change. I love change, I really do. And so this was the first place I landed where just a fundamental aspect of the work is it changes all the time.
That's true.
And
Yeah.
so that for me, um, I, I I think over the years though, I think this is a really good profession for people that like change. I have seen it also become a profession for people that are more analytical. We have a practitioner here named we call him Master Lee. Uh, he is one of the best therapists I've ever seen. He's absolutely amazing. But he was an engineer before he came here,
Wow.
and his work is like engineering. It's really amazing. And so I like that this profession can accommodate that way of thinking. Because there was a time period where the body worker was just a more esoteric or hippie maybe kind of person. And although I think that's still true, I like that the engineer still fits into this profession because they do. And he has a practice. His next appointment available like is April probably. He's
Yeah.
very busy practice. So
Oh, that's a good development. Yes. Hey, John,
yeah,
thank you very much for your time.
yeah. Thank you.